Hey everyone, Greg Mescala here. Thanks for joining us. More at home with USA Water Polo. This week, it's all about returning to play. And as we said it in last night's discussion, and we'll say it all week long, I want to remind everyone that we know, depending on where you are around the country, you're in different stages of getting back in the pool. Some of you are already back in the pool doing something that looks kind of like water polo. Some of you are just back in the pool, you're swimming. And some of you are not back in the pool yet at all, and you're really anxious to do that. So we know that's where we're at around the country. If you're not in the pool yet, we hope you can get back in soon. We feel your pain. But this whole week, it's all about discussions to help that return to the pool and that return to the play of water polo be as successful as possible. And we have some great experts with us all week long. The rest of the week here, some great folks that are affiliated with Hoag Orthopedic Institute joining us. And today we have two professionals, one that works with the women's national team, and then one that works with Hoag and ProSport, helping to join us. And I'll ask them to introduce themselves right now, Sam and Larnie. Sam, can you say hello and let us know a little bit about you and what you do?
Hi, everyone. I'm Samantha Baumler. I'm a physical therapist and the clinic director at ProSport Physical Therapy. We are currently in the Costa Mesa, Newport Beach location. I am about 10 years out since I graduated. I'm a local grad from Chapman. I have a history of graduating from San Diego State athletic training. I've also worked with many U.S. water polo players, water sport in general, but also have a lot of other sports on our background, being a sport clinic. We are one of 7 local clinics. And yes, we are partners with Hoag, which we're so excited to be a part of.
Excellent. Appreciate you being here. And
Of course.
Larnie, a Team USA fan, will know you well from the sidelines. Tell us about yourself.
Yeah. Hi, everyone. Thanks for inviting me to the discussion here. I serve as the sports medicine manager, athletic trainer for the USA Women's Water Polo team. Have served in this position for almost 5 years now, and my basic role is to help facilitate and manage the care of our national team athletes. On their day-to-day training when they're with us and when they're not, and working in collaboration with all multidisciplinary healthcare providers, including ProSport. We've had some athletes go there and thankful for their support and their care for our athletes. And I feel fortunate to be able to be a part of the team behind the team, and that supports our athletes in their health care.
Excellent. Good stuff. Thank you both for being here. And again, if you're watching live on Facebook right now, feel free to throw some questions, comments there, and we'll try to address them as best we can. Also, keep in mind, check our schedule for at home. There are a lot of other conversations coming up that might better suit the question that you have, or you can watch what we did yesterday as well, as it pertained to how areas are returning to play when it comes to a big picture health and safety officials, pools opening, that sort of thing. But for starters, Samantha, I'll start with you. And I know a lot of people are wanting to get back in. They want to be safe about what they're doing. They don't want to get injured. You're hearing a lot about that, right? From the NBA on down. Everyone wants to start playing again, but they haven't been doing their sport. They want to do it well and not get injured. I know you've assembled some different workouts, some things you've put together. What are a few examples maybe you can share with us of things people can do that can kind of help that transition along?
So I think the biggest thing for what we're seeing right now, most people, it doesn't matter if they're athletes, but obviously that's our topic. But the biggest factor that everyone has been having a hard time with is we're not doing what we normally do. Doesn't matter what age you are. I could tell you right now, all day long, I get patients back in saying they're more stiff, they're more tight, they feel out of shape, because even just going to school and going to and from places, going and hanging out with friends, that gets them active, that gets them moving, helps boost a lot of your muscles to kind of stay active. And people aren't doing that. I'm hearing a lot of these kids, no matter the age, are sitting at home and happen to be in front of TV screens a little bit more, and probably whatever they choose to partake in, probably sitting with their Zoom classes, no matter the age. And so stiffness is probably the number one thing I worry about at this rate, due to COVID, we'll say. And then secondary would be the loss of strength, the inability to attend gyms and get together with their teams and practice their skill set. As we know, swimming, water polo in general tends to be a heavy, repetitive sport, right? If you don't keep up with it, you lose your endurance, you lose your strength. So some of the factors that I'm looking for when I have someone and discussing about back to sport would be reestablishing a baseline program for flexibility, whether it be upper body and lower body, which is just as important, if not more important for water polo, because we know those legs are moving so fast and they got to be so strong. And then also reestablishing the small muscles that give you that stability to allow you to continue repetitive motion without injury. I think a lot of sports right now are probably going to try to push their season into a smaller space, meaning you're going to compete sooner and you're going to have shorter seasons, and so you don't have that ability to prep as much. And so a lot of the exercises that I kind of really push is static stretches you do on your own, simple exercises. A lot of the stuff I give is more or less stuff you could do on a bench on the side. You could do it on the pool deck. So I'm going to show a couple real quick for you guys. Just my basics, stretching. It's with a foam roll. Everybody can buy one off Amazon. I know everyone has Prime these days, especially due to COVID. So you can pull those up and put it on the deck. I'm sure they're waterproof. If they're not, we'll buy you a new one. So I'm going to pull that up right now and show you guys kind of one of the main slides that would be good. And there's a couple videos attached to it. So let me share my screen for you guys real quick, and then we'll get that going. So let me do that real, and bear with me, everybody. I'm working on my technology skills. All right, so it should be from your current slide. So let me take you through. So two of these exercises I love. The first one is the biggest one I give to all of my overhead athletes. It actually doesn't matter if you're in a pool or not. And the reasons being is, guess what position everybody needs to be in for water polo when you're throwing a ball, right? Like that. So a lot of times with all this sitting and all the activity that we haven't been doing, our arms get really tight across the front. So I like this video. It's very subtle. She's not going to move a whole lot. She's basically just going to hold that position, and then she's slightly going to turn away. That's going to allow the front of the chest to open up. I want people doing this on both sides. I want them doing it for long holds, 30 seconds to 1 minute. And really kind of trying to improve all of that flexibility through the front. The second one I really, really like because it's working on those lats, which I will try to not talk so overhead a little bit on muscles, but you can tell that that's a big one when you're swimming in the water, get that arm flexibility. And so this would be a starter for what I would essentially have people do. The next slide, once I go through these two videos, is a big one, just laying on that foam roll, working through opening up the chest, opening up the spine. These are things that people, in my opinion, should be doing every day if they play any type of sport, but specifically for water sports, because you get so tight through the front of your chest. This is what's going to allow you to open up all that stiffness you've gotten from not doing anything and really get you to kind of be ready to push forward on the repetitive swimming motion. Maybe it's throwing repetitively, all that kind of stuff. And this could be done any age. It doesn't matter what age you are, you can get tight. And it's definitely one of those ones that is safe for everybody. That's my biggest thing with all the stuff I'm going to give. If I give any suggestions, safety first and pain-free. If anybody has pain, you shouldn't be doing it. Let's bottom line it. Go talk to Larnie, go talk to your people. I'm not okay with pain. Pain is not okay. Unless you're like dying from swimming. I'm okay with that because that means you're out of shape. But other than that, that would be my recommendation. And this last one is more like a snow angel type, where you're working through, going through range of motion. It's all on reps. It's not necessarily, you go to the beat of what's comfortable. So those would be my recommendations for flexibility. And that would be something that I think is safe for everybody to essentially be doing, to answer your question in a long format. I have a million more, so
no, that's great. It's great. And, you know, those look really, to your point, there's no excuse. Those look fairly simple, kind of comfortable. I mean, and the one you're laying down, so that seems like it's not too bad. You can all do that quite easily.
Just close your eyes. That's right. You get to lay down, people. That is what I told you.
Exactly. That's how you'll be able to stay a little bit more flexible. Stretching is key. As someone who's getting older, we can all attest to this. We'll come back to some of those. Larnie, I want to pass it over to you. You're working with the women's national team now as they work their way back into training, right? There's still not anywhere near a practice that you might see the team normally do, but what were the big things that you were talking to the team about on that first day or as they were starting to get back in? Because there's no more motivated group than a bunch of Olympians and Olympic hopefuls. They, want to get right back to 60 miles an hour. How do you temper that?
Yeah, that's super true. I think a couple things is, um, I think the motivation that they have when they're all in the pool is more of competition, and they're super competitive, and so in that nature, they're gonna want to swim fast when they're in the pool with their teammates. And so I think a big message is, we have an understanding that people are coming from different places, and I think there's a learning of knowing where they are themselves, because everyone had access to different things, whether they had access to a pool or they had access to weights, to be able to load their body a certain way, or they may have been invested in a different type of physical activity like running. So there had to be an understanding of where people were coming from. Our strength and conditioning coach, Tim Pillow, devised a program in which our athletes would be able to be active 5 days a week, 6 days a week. And so I'd say a majority of our athletes were able to do that again with what they had. But in coming back in the water, I think the water fitness that they may feel is going to be quite different. So the message to them is know where you are, and coach might give them an interval, but know where your interval is in that moment, because you will get to where your pace was back before our hiatus started. And so the big message is to kind of be patient with themselves into being back where they were. There's this example, I think you were there when we went to Texas, and there's this really good barbecue place called the Heart 8.
Yes.
And man, I love brisket, I love ribs, and they slow cook everything. That's why it's so good. And that's our message to our athletes is we're in the slow cooker. And because one, we know that there is a loss of muscle that Sam had mentioned. There is a slight loss of fitness and endurance. And so, but we need to slow cook this, because we know that the Olympics has been postponed. It's hard for our athletes to be motivated, knowing that it's so far away, and there's a lot of uncertainty of where things will be. Whether when we will play a game again. So the focus is more on just getting back into our mechanics, especially in the weight room. We're not doing anything heavy. That baseline program Sam had mentioned, that's kind of what we're doing, with the exception that we have an opportunity to load them differently, in which is what they haven't been able to do at home. So that's the difference from what our training is now, and be able to just, again, kind of pull the reins and make sure they understand what their body is doing, and being aware of that.
You bring up a really good point there. And as you're talking, I was thinking about, well, the high level athlete that is training for the Olympics, or maybe it's one that goes to ProSport, they have maybe a better sense of their body, right? Especially at the Olympic level, they've spent a lot of time learning what their body responds to and what it doesn't, right? What they eat, how they work out. I think about the average 15-year-old that is excited to get back and play, and they do not know how to go through a checklist of how they feel and what they've been doing in comparison to what they normally do. Larnie, is there a general, and Sam, if you have thoughts on this as well, but I'll start with Larnie. Is there a general checklist the average athlete who's a high school club kid could say to themselves, like, oh, how do I assess where I'm at, what I've been doing, and where I need to go at an appropriate pace?
Yeah, sometimes I think at that age it's a bit of a trial and error. That they have to, when they put that ball in their hand, they're super excited, and this isn't any different from our national team athletes. Is they're ready to shoot, and they want to shoot because it's something they haven't done in a while, and to feel it the next day is kind of that message, that okay, that was, we need to pay attention of our level of intensity and be able to grow into that. And fortunately, youth always have their age on their side, and they can recover quickly, and sometimes that's taken for granted. But I think within that trial and error, I think when the questions are asked like, "Whoa, I'm really sore. That I hurt today," when I do that motion, those are learning moments.
Sam, anything to add to that, just from the athletes you're talking with and kind of how they can assess themselves appropriately?
Yeah, it's interesting she says that. I totally agree. I think, you know, when you prepare for something, you kind of know the expectation and the outcome. Right now, everybody's trying to prepare for what they think they know, but they really don't know because they can't test it out, right? And so when I get someone to that point, whether they were in rehabilitative state or just talking to me in general about what they want to do, I usually kind of just say, well, why don't you try it? Right? I mean, worst case scenario is if you have pain, you're going to stop. I mean, I would hope. National level, they're not going to stop, and that's us to fix them. Let's just be honest. That's just that's the way they push. That's what got them there. But I don't recommend it. But if they're, say, our 15-year-old we're talking about, they're going to go out there and they're going to realize it doesn't feel as good as it once did. And so that's also not only our job, but also Larnie's job to kind of say, okay, great, you didn't feel as good as you wanted. So maybe next time, and Larnie and I talked about this a little bit before coming on today, dialing back your effort. You can go in and swim 5 days a week, but you don't have to swim at 100%, right? If your effort is 50 to 60 to start, maybe you're not 5 days a week, maybe you're 3 days a week. And maybe at that point, you're doing dry land training in the morning, depending on the team, because you can't get in the pool but 3 times because those are the regulations of COVID or the school or whatever it may be. You can play with all of that. But the biggest thing I would recommend is just try. You go and see how it feels. If it doesn't feel right, it's not right. And you can listen. I don't care what age you are. If it sucks and it hurts, and if it's not right. And I think that's my usual recommendation. If I have any kids in that are like, can I try this? And if I think, obviously I'm on a rehab perspective, if I think it's appropriate at that time for where they're at rehabbing, I'm like, well, let's try it. I mean, worst case scenario is you're in for 5 minutes, it's miserable, and you're out, right? So I would encourage people to not be afraid to try, no matter the age. If you really haven't done anything, you're going to be sore and you're going to have that. But best case scenario is we get your baseline, and then you go and talk to coach, or you talk to mom and dad, or you talk to individuals like Larnie that you have on service, and see, okay, so where do I go from there, right? So then you're dialing back, okay, I can't go 80%, I'm going 60, 70, and 4 days a week was too much, I'm at 3. I have access to 3, I'm going to push and push and push as you go week to week, not day to day. And that's what she was saying, is you never really, you don't know what anyone has access to right now. And so if you're starting from scratch, start from scratch. If you're a month in, jump in and think where you're at and just kind of feel it.
Larnie, you were talking about kind of setting expectations with the national team, and you're in a scenario where there's a larger staff, there are multiple coaches, there's yourself, but most of our clubs that are going to get back to it, you're talking about like one person, maybe 2 people that are in uncharted territory, right? They know how to coach the game and maybe coach fitness to an extent, but they haven't had to kind of set these expectations coming off of a long sort of stoppage in play. Just in your area and your expertise, how important is it for coaches, even though this isn't necessarily their area typically, but how important is it for them to be, because they're the ones the kids are going to listen to, how important is it for them to kind of set appropriate expectations, the way you were talking about how you're not going to be where you were right away, and how this is the slow cooker of water polo and it's not immediate instant results?
Yeah, I think it's I think having those conversations, and setting And I think it's almost a pressure release off of the athlete as well, to let them know, like, um, I guess I'll caveat in this way in saying, like, we always talk about the end in mind, and knowing like where we want to be, and working backwards. And at this point, we don't really know what that is. But if they do know that, or if they know that, this is where we do have access in the summer, in a summer program, is to be able to, as a coach, to be able to map that out, and to be able to communicate that with their athletes, and from where they are, so that they in their mind have an understanding of that. Yes, this is where we are. We're functioning at 50%, and in 2 weeks we're going to function at maybe 30% of intensity and in volume, and then at 6 weeks we're going to function at 20%, and then in another 2-3 weeks we're going to function at 10% of our peak volume. And but at any point in having that plan as a coach, you're able to scale in or scale back. And so I think that communication with the athlete, or with the coaches with their athletes, and sharing a plan, and those expectations, is helpful for everyone all around.
Sam, you showed us a couple of workouts and just movements really earlier. Let's maybe go back into some of those, what the progression would be after that, after some of those initial movements, and where you might take things as you're kind of advancing on.
So for a lot of the time, I mean, I obviously, if I had the world and the plethora of showing all the exercises I have, for the whole body, I think it would be great. It's just not feasible, or maybe a safety. One of the things that I always recommend with a lot of my overhead athletes, though, is a warm-up program, and those are usually TheraBand based. Super easy, tie it to a chain link fence, and I'll show that exercise real quick. A couple of them, there's like 5 that I do. And the great thing is this isn't just for water polo. It could be for swimming, could be volleyball, for example, could be baseball, all that kind of stuff. So I love it. It's one of my go-tos. I give everybody these exercises. So let me walk you through. There's 4 or 5 different videos that I would show for just the warm up in general. And that's this one where it's really cool, because I like it because you could put up a bunch of bands on a deck, and you could have some guys hop in the pool and warm up, hop out and do some of the warm up and the arm workout and all that kind of stuff, really focusing on shoulder blade and rotator cuff type muscles around the shoulders. And then those kids can jump in and swim, and the other ones can jump out, and you can kind of rotate, and it doesn't have to be, this set rigid type exercise. It just becomes their routine. So let me share my view real quick for you guys. And then I'll pull that one up real quick. But I like them because I think overall, most individuals find it very comforting, pretty easy to do. So what you would do is tie the band. So we have a TheraBand wall in the office. It's super easy and awesome, so we're blessed. But you just tie that band to excuse my language, but I think it's like a carabiner is what we use. I don't know how to pronounce it. But anyways, you link it on the fence, and you could take it with you. So if coach had 5 of these bands, you buy them off Amazon. Not that I'm sponsored, but it's really easy. And you just link them up to the fence. And so this first one I'm going to show you, she's just doing external rotation. Fire that rotator cuff up. You could do 10 to 20 depending on the athlete. Simple, it should be pain-free. No issues. That's a light resistance band that comes in all different colors to make it harder. So obviously the different ages, you do this for a national water polo guy, he's probably going to be on a blue band, but he's doing the same warm up as a 15-year-old on a yellow band, because guess what? It's the same dang muscles. It doesn't really matter. And so the second one is going to be internal rotation of the shoulder. Typically I would put a towel under elbow. I figured that was probably asking too much for a on the deck fly. So I just left it at this, and it would be more than capable. I had our Flexor shoulder, she was letting it kind of come in a little bit too much. And then when you look at this third one, this is one of my favorites. It goes into a high row. It'll be a high row, and then you'll see her do a couple sets. She's going to do a high row, squeezing her shoulder blade, and then eventually the next one she's going to do into a high row, and then she'll go into almost an externally rotated position at shoulder height, and then she'll do a couple of those, and then the third add-on of this is she'll go into a high row, she'll go into external rotation, and it should be the next rep she's going to actually go into an overhead press. I like all three of these specifically because it really shows how to use your rotator cuff muscles control with your shoulder blade. These are great prep exercises. They're not supposed to be to the point where your kids are literally like shaking their arm out dying. They might initially, because we're going to assume some of them are not quite in the best shape. But you give this to any level. I have high level professional baseball players. I'm teaching this to them with a higher level band, and they're expected to do it before they go to practice, before they play in a game. You do it for a 12-year-old kid, they can do it just as well. You're just going to have to control how the function of the arm moves. The next slide, I'll show two more. Let me get through these ones because it kind of double plays them. So these two I like because they're kind of similar to a swimming position, but it also is working front plane and backside control of the shoulder and coming all the way up. Forgive the shakiness. We were having issues with the way the band was attached to the wall. But typically it should be pretty smooth. You're working in a multi-plane, you're pulling down and in and then pulling up and out. The second one is going to be the opposite direction, which you're just working on that ability to kind of pull through resistance, which is very similar to having to swim through water, correct? So these are my go-tos. These are what's going to help you warm the body up to get in the pool. And those would be ones that I would absolutely 100% push as a starter for all these coaches to feel like, okay, where do I start with these kids? Or national level to get them so they start this fresh start of training the right muscles to get them in the pool and hopefully prevent injury, because those muscles are already woken up to allow them to fire. One thing I noticed with swimming, and not to go on too much of a tangent because I have a million soapboxes for every sport, let's be honest, but is the transferring of how we do things in the water and how we train on land. And I love land training. I highly recommend all levels, all ages do land training because it does transfer. It just doesn't transfer the same. And so when you get in the water, you got to be able to use your shoulder blade, but use your shoulder blade the way these exercises ask you to do it. And that's a hard transfer for individuals, especially younger. Not necessarily at the US level, that we're correcting because they've moved wrong for too long. The kids that are young, we're just training them how to do it. And so a lot of times I might say, okay, when you get in the water, think about that shoulder blade like we did on these warm-up exercises. Think about pulling that shoulder blade back and think about using it similar to how we do these exercises. And it'll make them stronger and it'll make them swim better in the long run, but also it'll prevent them from getting injury because they're allowing the body to move efficiently like it wants to and like it should have from the start. So those would be my recommendations on, simple kind of talking about learning and really figuring out how to get them back, but not overdo it, especially with like effort and getting them back to where they need to be, I guess, is the right way to start. And like I said, not 100% foolproof, but you could feel pretty confident in giving these to almost anybody at any age, as long as they're doing it pain-free.
Well, and just to follow up on those, I thought those are all easy to follow workouts. And if you're just joining us here, we're talking about kind of a healthy return to play. So preventative maintenance to make sure you're not getting hurt as you get back in the pool. Everyone's waited so long. The last thing you want is to be injured. Talking with Samantha Baumler from ProSport and Lonnie Bocarin from the women's national team. Samantha, on those things that you shared, those look like things that would be good in any season, right? So whether you're coming off of a long layoff due to COVID or just getting ready for your next game, is the big difference going to be what sort of kind of, I guess, fatigue or tension you feel based off of how ready you are when you go through those workouts?
That's a great question. I think all all of these exercises I've shown so far, if someone were to want to reference back and look at them, you could do these throughout the whole season. And that's different than what Larnie was kind of talking about a little bit about building the strength in the performance training, and building and pushing for heavier weight, maybe depending on the age bracket. That is different, right? These ones you can do all the time. I always recommend do it before every time you practice, do it before every time you play. In a game, because that's going to set your body up to know that these muscles need to be working and this needs to be the function of the shoulders, versus, right, if we're talking, and somewhat out of my scope, but the small degree I feel comfortable talking about, when you're performance training, right, you're going to change how you do that per the season, right? You're going to lift heavier preseason, hopefully, and build your strength. Then during season, you'll probably dial it back to some degree to allow your ability to swim more and account for not causing injury, and you're not really trying to work for performance because you should have already trained for that. And then post, you're actually working on kind of just keeping the body going and moving. These can be done throughout the whole season because of that. They're not high volume. You could do high rep, but they're not high power or anything like that. It's just simple, fire the right muscles and get them going.
That's excellent advice, and stuff. Like you said, there's not a lot of equipment there to purchase, right? Talking about a couple of bands,
Yeah.
you know, the Amazon, but no, I'm kidding. But you can tie into a fence or a wall, right, and make them work. Larnie, one of the big things we've heard from water polo athletes over these last 3 months is, for the ones that have not had access to a pool, they are concerned not only about their swimming, but especially about their legs. Water polo is such a leg-dominant sport. Egg beatering, obviously the way that this works in water polo, that what propels you above the surface. All of our fans know that. I'm curious, the athletes that have come back to Team USA, the ones that did not have as much pool access, so that we can kind of give some guidance to these athletes that are fearful of getting back in the pool because their fitness isn't there. What are some of the things that the Team USA athletes have worked on to try and help rebuild their legs? Is it as simple as just getting back in the pool and treading for a long time, or are there other things that people can do to help ease the transition back into heavy leg usage?
Yeah, I think there's two things. One is I'll speak to just, in the water is taking it slow, understanding where your volume is. I've from our athletes, egg beating is one of those um, movements that can, if you've been away from it for a while, the range of motion that it asks of you, the stress that it can create on the inside part of your knee, and not allowing the time, or just, again, slow cooking it to that increase of volume, can be discomforting, or your body will certainly feel it, like that stiffness that Sam had alluded to earlier when she talked about foam rolling and things like that. And so I think understanding that part of the in the water is giving yourself the grace to build that movement in the water. And two, I guess the learning piece of that is how is your body going to respond to that? So some things that I know in some patterns of our athletes is that their hips are going to feel, especially on the side of their hips, the muscle called the TFL is going to fire up really, really good, or they might feel pain on the inside part of the knee from doing that movement or being away from it for a while. And so one is working on mobility, and that is working on just the amount or the degree in which that hip joint could move within itself, and kind of loosening up that stiffness. So we'll do things like doing some traction with a big band attached to something. I think I did at home with USA Water Polo, in which our athlete had stayed in a figure 4 position while receiving some traction from that band. Two is also just in the same way, and that Sam showed in those shoulder exercises, is I think of the hip as a big shoulder, but in your lower extremity. And so in that same same line as there are hip exercises that can wake up and activate those hip muscles for egg beatering. If there is a feeling of knee pain, I think from what I've learned, it's not so much the knee pain as it's much as your hip that doesn't have the range of motion in getting into a wide base, and that stress of, if there is weakness in that hip, that stress is going to go down to the knee. So Sam, I don't know if you have
oh my gosh, you were a girl after my own heart, Larnie. Oh my god, I already pulled them up. I am ready for you. I am
so
cute.
Good segue. So
yes.
See how that works, Greg?
Beautiful.
I kind of knew.
I'm just gonna head out for some barbecue, and you guys.
Yeah, right. Okay, let me pull it up real quick because I didn't get a chance to show the lower extremity stretches that I would recommend, but I am a huge fan of piriformis stretching, which is your hip, people. And Larnie was talking about being able to put a band around the hips while you're doing a figure four. This is called the figure four. And when you put that band around it, it's going to allow you to be able to stretch. You could put it around this hip, you could put it around this hip. This would be my recommendation because it can kind of help traction the hip like Larnie was talking about. Same thing, all stretches, 30 seconds to a minute total. Do it a couple times, give it time, sit in it. The other one that I would highly recommend, and you can use a band with this, is the half kneel hip flexor stretch. Hip flexors become a huge problem with egg beating because obviously your legs are up high and they're beating around. You're also not really able to kind of relax your hip flexors while you're in the pool doing egg beating. And earlier on in my career, I have a funny story. I really never had a water polo family. We grew up the soccer, the golf, and the baseball type family. And so I had my first water polo athlete. And of course, first real heavy, big name type water polo athlete. We'll leave it at that. And I'm at home Googling egg beating underwater because I was like, what the heck is this? I don't know. Mind you, this was like 10 years ago. And so I've really learned how to develop the proper lower body stuff that people need. And that's figure four is a good one. Hip flexor. On this hip flexor one, like shown on this slide, you can wrap a band from this direction coming out or even the other direction, depending on what leg's down, to really help traction and get a better stretch. Like Larnie was saying, that TFL, although anatomically a muscle no one should care about, it is a big one with egg beating that gets tight, gets overused. You should be technically able to use your hip muscles to help support that, but people overuse their hamstrings. I've seen a lot of hamstring strains when it comes to egg beating. So a lot of this will help open up the hips, which will allow you to get in those positions to use those muscles functionally. And then also limit the stiffness like Larnie was talking about, and really promoting that return to normal swimming function and underwater type control. The other one I was going to show, and let me pull it up real quick because I think it's a good one. Everybody hates these, but everybody knows them, and nobody likes to talk about them because they just pray that they're not going to actually get them as exercises. We call it glute prep, and unfortunately they're torturous on your glutes. But why we like them is because it forces you to have to use your butt muscles. And when you can use those muscles, it looks like I'm already sharing it. So let me go through real quick and find the right slide. I apologize. It's all the way at the end. Here we go. Okay, so let me move. So when you're looking at glute prep, this first slide, the far one on the left, the key is in a close. This is why I like dry land. So, right, you're thinking, why is this important? She's on land. She's not in the water. But guess what position that's very similar? If you're doing egg beating, you've got to be able to use your butt muscles in this position, right? And we all know that underwater, it doesn't look this pretty. We know it's not as pretty, but you're in the same position. So you should be able to use those hip muscles to identify. The bands add another extra resistance. I don't need to tell you where to buy those. I think we all know where I'm going with that. But being able to fire your butt muscles in this position, you do one leg at a time. You can do both legs at a time as shown right here. And then the second one I love because it really allows you to stabilize one leg and step back. That's going to get your glute muscles in a kicking pattern too, right? When you take your leg back like that, if you were to simulate a swimming stroke, you're actually in that same position, have to use those same kind of muscles. This is huge. Any athlete could do this. We all don't use our butt muscles enough, in all fairness. I could say like 9 out of 10 patients that I get, no matter their age, injury, sport, could use this exercise. In fact, I give it a lot of times for like shoulder injuries, because most people don't have strong glutes, and you need glutes to be able to swim and be able to egg beat people. So that's important. This one would be my last and final one that is a monster walk. There's also a sidestepping slide, which is not on here. I can find it for you guys and play it. But this allows to work a little bit of hip flexor too. And then when you come backwards, you're also using that hip extension, which is huge for swimming. These are like golden for dry landing training, and anybody could do these. Now, you watch a 12-year-old do this versus our national team athletes do this, it's going to look a little different. We're going to have to control it a little bit more, and it's not going to be as great. Typically, when they're younger and it doesn't look like they're controlling it, I would drop the band around the ankle and just keep it around the knees. Kids tend to do better with that and are able to control, but it's not as pretty, let's be real. So, but I definitely feel confident that anybody could do it without having extreme pain. And that would also avoid what Larnie was talking about, that medial knee injury that is pretty common. This allows you to get stronger in areas that's not going to put more stress on the medial knee. So that is what I would recommend. And they are killer. I hate them.
But they also sound helpful. Yeah, I mean, if you have another 1 or 2 leg focused exercises, only because it is such a pivotal part of water polo. You ask anyone that plays at a high level, right? They'll talk about their leg foundation. While you're looking for that, Larnie, I just want to ask a question to you. We talked earlier, both of you were talking about the idea of try it, see what sort of pain you get, and then kind of inform a decision based off of that, right? You'll know when you're hurting. I'm thinking about the athlete that aspires to be great, right? And they really want to push themselves, and there's that feeling like, well, hey, if it burns, it means I'm doing something, right? Like you're feeling something. Larnie, how do you balance those, right? There's the pain that means that you are building muscle or that you are increasing your flexibility, but then there's the pain that means this is not great for me right now. How does a younger athlete figure those out?
Yeah, I think understanding the difference between a soreness and a pain. And so I think of when, and this is, I worked in a K through 12 school as a physical education teacher for 9 years, and it's always really interesting. And this classic story of like, an athlete might they love like the bicep curls, and they're just like, oh, boom, 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 building up, doing bicep curls. And then they come in and they're like, I can't straighten my arms. I can't, it's just, I think I'm broken. And it's just like, you're okay. You're not broken, that you're going through a delayed onset of muscle soreness. And so here's some stretching, here's working the tissue a little bit, and that range of motion should improve. So lesson learned there, you don't have to do 100 biceps curls for your arms to get into where they just don't want to move anymore. But in the event that they're doing an activity and they are unable to improve, there are signs of pain at night, there's signs of swelling, there's signs that within the next 3 days their range of motion doesn't get better. Those are indicators or flags of, well, did I do an injury? Did I injure myself in doing that activity? So that's just, working with younger athletes is trying to define, what soreness and pain is. And I think as clinicians, not being, assuming either that they know that difference. And I think our roles as clinicians and healthcare providers are always in good intention of educating and not only themselves, but also their families or their parents and their coaches of what that is also.
Excellent. No, very, very helpful advice there to kind of distinguish between the two. And then let's swing it back over to Sam as you were working to pull up some of the leg work.
Yeah, to touch off what Larnie was just saying, I think that is probably the hardest misconception, is that pain is going to get you further. And I think identifying the difference between pain and soreness, and at a younger age, it's definitely harder. And I think that's, sometimes they'll do a pain rating. You go to the doctor's office and they have the happy face and the unhappy face. And it's like, really, like, what does that tell you? Probably nothing. But some people conceptualize the visuality of that, and it makes sense. And so I think if a parent were to be listening, I would say, get to know your child and how they feel. When your kid fell when they were little and they screamed and cried, they know what pain is. Right. And so if your kid's 15 and you're trying to teach them, okay, is this good pain or is it bad pain? If they stretch, does it feel better after, and stuff like that? And you can kind of manipulate how their pain is. I think it's very hard as a parent to understand and not just assume they're faking it or they're making it up because they kind of want to just get out of certain things. It's very, very hard. I think the more and the better you know your kid, and worst case scenario is reach out to people and see what their advice would be. If you happen to know a physical therapist or an ATC, or talk to coach, hey, do you think this sounds about right? There's no second, you don't want to second guess it, because you don't want to push your kid into pain, but you also don't want to fall privy to that, like, that element of my kid just needs to work a little harder, because it happens and everybody's different. But to go back to one other exercise that I love for getting your butt firing, excuse me, I couldn't find the right words there, but is bridging. And so one of the things that I really, really enjoy is changing it up to make it harder. So it's simple. It's nothing big. It's no news to any high level athlete. But the biggest thing is being able to squeeze your butt and lift. The reason I like this is because you're also working with a bent knee position. Once again, if you turn this person inside a pool doing this exercise, what does it look like? Kind of similar to egg beating a little bit, right? The difference is they're able to push through their heels, but that allows them to feel their glutes better and incorporate their hamstrings, which are all equally important. In this position, you're also not able to use your hip flexors as much, which also would be what someone would want to use in a pool. This one can be easily made harder. You could have them bridge up just like she is. When she bridges up, you can lift one leg up and almost turn it into a march. When she comes back down, you could have them extend one leg and bridge up with one leg only. You could have them do one leg up and lift the other leg up at the same time. There's so many variations to a bridge, and you can make it as hard as need to be. You could put a band around their knees, which is going to reinforce more of that butt firing. So simple, easy to do on a deck. And this is the type of stuff that people overlook, because it's not with a barbell and you can't load it with weights. And it seems like it's not very manly. I'll be honest, most of these kids would be like, that's what my mom does in yoga, right? But well, guess what? Mom's doing something right. So that's one of the things that I would recommend, is like really understanding the basics of the right movement patterns and why it could transfer and why it could be important. And that's kind of the fight that we have on our end. Larnie was talking about how it's kind of hard to differentiate like pain, all that kind of stuff, and how to explain what you do. We spend most of our day in our office explaining why this basic exercise is so important and why it's going to get you where you need to get. We have a performance side to our component and a lot of our speed and agility classes and our strengthening classes with these kids are doing just this, simple bridges and just doing variation. Maybe you add a weight plate to their belt and they're lifting against resistance, right? You see professional NFL players putting a full bar across themselves and doing a bridge up like this. There's so many different ways to do it, but if you teach the basics and build on that, the foundation acts at, 6 weeks to 3 months down the road, like we were talking about, that effort, it could build into what you need it to be continuing and safe, right? So, I don't like to show such simple things because it's not flashy and it's not cool. But guess what? The reality of it is that's one of the best exercises you could do to get your butt firing and to teach someone how to properly move and protect their spine. Because as we know, spine injuries is a huge one for water polo, right? So my recommendation on that is absolutely 100%. Don't shy away from the simple exercises. Just add to them if it doesn't feel like it's challenging enough for your athlete. And don't be afraid to do the basics, because guess what? The basics is what's going to get them to a successful season and a successful injury-free season, which is the whole point of this, you know?
Really, really good stuff from both of you. For those that have joined here, if you know someone that might want to watch this, please pass them the link. We'll share it on our YouTube page as well soon. A lot of, as Sam said, it may not be the flashiest thing. It's not going to be on America's Got Talent, but it will help you get back in the water and be a bit more flexible, be a bit more healthy. Same goes for some of the stuff that Larnie talked about as well. Just final thoughts here as we wrap up. I've done this with some of our talks in the past, but kind of your elevator pitch, if you will. You come across someone has trepidation about getting back into the pool, some bullet points they need to know, some things if you can leave people with nothing else but as they prepare to get back into the water or back into training. Sam, I'll start with you. What are just some main things you'd want folks to know?
If you don't use it, you lose it. So guess what? You got to figure out how to start using it. You got to start square one. The other thing is build off your basics, start small, work big. Larnie touched on it a little bit, is know your end game. It's so sad, all these Olympians, right? To not go on another tangent, but they had all their prime, they were ready to go. And now they have a whole nother year to train. Sit back, relax, reprogram and retrain and work yourself back up to that. It's no different than these kids that haven't been in the pool. They got to start somewhere. Where's your end game? Proper communication with families, kids, expectations, finding good resources to help them, and giving individuals the opportunity to get where they need to get is going to save a lot of time, a lot of heartache, a lot of frustration, and it's going to have a successful year for those kids to be injury-free, or those high-level athletes be injury-free. I would say now is the time to actually hear what individuals like us are putting out, because I think coming off of this whole pandemic, it's going to be the biggest factor is to reduce injury because of these uncharted territories that we've all been in without access to stuff. And so I think it's not a warning, it's a recommendation, and hear it, because it's super helpful. And if you guys don't know where to start, I would happily take an email and say, hey, I heard you, like, what do we do? And I can set you up with connections. I'm sure Larnie would do the same. I'm sure if you got the same call, we all know people in our lives to help guide coaches and guide performance coaches or whatever it may be, to really get your kid or your level of play, whether it be at high level, back to where it needs to be.
Larnie, your thoughts?
Yeah, I think, and this is a hard one, is patience. And I think we, in the whole grand scheme of thing, in all things, it's about patience and allowing ourselves to grow in the whole process again. But at the same time, I think the time is a blessing, and we can't forget that. Because we are given an opportunity and a gift to be able to start again. But I wouldn't say not from the bottom. And so to remember that, because I think we can fall into a dark hole and not be motivated and think about, oh, I was here 3 months or 4 months ago, but here we are now, and you've been given the gift of time to be able to work the process again. And so being patient with ourselves in the whole, in all aspects of growing in strength, but also, in growing again as a team, because we're living in a new kind of normal in which being able to socialize ourselves is different too. And so I think from this whole process is learning that it's another opportunity to grow, and another opportunity to be better in different aspects, and not just the physical aspects of it, because everyone's kind of is in the same boat, to be able to start from the beginning.
Excellent stuff. Really appreciate each of you sharing your time. Larnie Buchanan, Women's Sports Medicine Manager for the USA Women's National Team. and Samantha Baumler with ProSport and Hope Orthopedic Institute. Thanks for joining us here today.
Of course.
Greg.
Thanks for having us. Bye, guys.
Thank you.